Hi, I'm Ginger Bratzel and gingerbratzel.com, a new patient attraction automation, and I want to talk to you about something a lot of people don't like to talk about, and it's really hard for sometimes to put in this situation, but it's talking about problem patients and terminating patients. See, I told you it was a hard subject. I felt the sigh right there. I made the sigh for you too. Sometimes it becomes to a point where we need to terminate a patient. Now, it's always, I always get these questions: how do you deal with a problem patient? How do you deal with they won't pay their bills? How do you do it? My first response is, how do we get to that point? It's hard to correct. It's like my kids are having a meltdown in the grocery store. It's not what I do right then and there to get out of the situation. It's what led up to that situation. We make sure we don't get in that point again. And so we learn from our mistakes there. But, it makes sure you have clear systems, clear written policies, and not letting things get to that point. But sometimes you get to the point where you have to terminate a patient, and it's really, really hard to do. As dentists, sometimes you think, well, as long as they're paying the bills, I have to take anybody. But let me tell you this: in the principle of life, you attract certain things, and you attract light things. So if you have a lot of negativity and not a lot of problem patients in your practice, you will continue to attract that type of patient. If you get them out of your practice, you open it up, you tell the universe, I am open for great, prosperous things. I want to help these people. That will open it up. There's only so much room. It's a vacuum, and you'll keep pulling negative people if that's the situation. So sometimes you have to get rid of patients, and it might be one patient, and it's really hard going through the process. You need to make sure you're not in the middle of care. You need to sometimes your malpractice insurance will have policies that what you need to do. A termination, you got to make sure you have the records. You need to make sure you're not abandoning them. You need to give them time to find another dentist. Those things. But you need, what I'm talking about is your gut is to pull the trigger and to do that. A few years ago, during an office meeting, I gave my longest working employees, to show them my appreciation for them, I did an exercise with them. And so it wasn't open to the whole office. These are people who had been with me 5, 6 years or longer. And I gave them an exercise first. I said, give me the name of 3 patients that you wish that were out of the practice and gone tomorrow. And they wrote their names in the practice. And it was really refreshing for them. It was really liberating for them. And then I said, okay, I will terminate those people. I will discontinue those patients. Those were their 3. And nobody had the same 3. I found that interesting. People that you wish were gone. And, when we sat down, I said, I will get rid of them. They said, you would do that? I said, yes, I will do that for you, because I don't want that negative drain on the practice. And I'm not disagreeing. They weren't wonderful patients. I didn't have to say, oh, no, we can't get rid of them. Oh, no, they referred too many people to us. No, I gave them that liberty, and I say that. And I said, are you sure you want to go get 2? And they looked at the names again. And in some cases, they said, well, you know what, I can tolerate them. And I just was so excited. I'm so fulfilled, and I feel so liberated that you'd even give me that option. But I can deal with this one person. But the other 2, if I never saw them again in my life, and mind you, we were in a small town. We would see them at the grocery store, you can see them at Walmart, you can see them all around. But they said, no, you know what, I really would like to not deal with them. And so you can terminate patients because they don't mesh with you. It's not a cohesive environment. It's a conflict situation every time they come in. You say it's black, it's white, everything like that. And it's just not conducive to their care. You're not giving them their best, and it's not what's right for them. And sometimes they're not strong enough to pull the trigger and go find another dentist, so sometimes you have to help them along. And so, out of that, they found there was 2 patients I gave it to 2 employees. There was 2 patients, and we terminated them and said, this is just not a conducive environment. We don't feel comfortable treating you. We just don't seem to mesh, and I want the best for you and the best for your care, but I'm going to recommend that you seek care somewhere else. We'll be available for the next 30 days to allow you to find another dentist in that time. Nobody had treatment in progress, and I want to wish you well, but I just don't feel like you're happy here, and we want you to be happy too. So, when you come in, you're not happy. And, one of them was very insulted. They're very important in the community. Just ask them. And how would someone get rid of them? But most of them, they just left. They were happy, and it didn't affect the practice in any way, and it really freed us up. So, some doctors will go through, Jack Welch talked about cutting the bottom 10%. Sometimes you got to cut 10% of your practice. Maybe it's just 1 or 2 patients. You need to have a system to do it, and you need to make sure you have all your ducks in a row. But I want to give you that freedom. You don't have to treat every patient. You are not everybody's dentist. You do not have to put up with this. And, just not calling them for recall or trying to hide and not return their phone calls, that's a cowardly way to do it. If you really want them out of your practice and you really feel it's in their best interest, because if you don't, you should not be treating somebody you don't like. Let them go. Set them free and let them be someone else's patient. They might not be someone else's problem. I'm not saying passing your problems on them, but it'll be a different situation. It's just like when you release a staff member that this is not the best environment. You give them the opportunity to start over fresh with somebody else. So letting patients go is very, very important. Let bad things go in your life. Bad relationships, not just patients, people, friends that are bringing you down, business relationships, you've got to let that go because life is too short. This is your practice and you deserve all it is. So if you want more information to get more of the patients you do want, all the patients you need, go to my website at gingerbratzel.com. Or if you want to talk to us about working together potentially and you want more information about that, please email my team at results@gingerbratzel.com, and we'd be glad to get together and see what we can do for you. So I appreciate your time. I wish you nothing but prosperity, happiness, and the positiveness of most, is that even a word, of most environments. Take care and bye-bye.